Hi everyone. I wanted to go over Chapter 5 just real briefly with you. And Chapter 5 involves transformational leadership in healthcare and looking at healthcare reform. As we all know that we're still in sort of a flux as far as where we stand with healthcare reform. And knowing that we're really looking at an evolution or a transformation of healthcare in general. So when we're looking at leadership styles, it's so important to really focus on the aspect of making that big culture change in healthcare and the nurse's role in making that culture change as well. There are many types of leadership that you can use to promote change, whether it be servant leadership or transformational leadership. You can use different skills, and most of us are some kind of blend of different styles, but most of us have a dominant style of leadership. And there's different areas that we can actually grow and develop within our skills. And now's the time to really focus on change skills and helping to transform healthcare in general. So when looking at leaders at this point, leaders must be able to trigger those culture changes, and this is well beyond doing a change in a policy or a change in a process. This is looking big picture and looking at the complexity of healthcare and going back to Chapter 4 a wee bit, looking at systems thinking and how everything interacts with everything else. And that's such a key factor to really hone in on is complexity thinking as well. We really need to focus on these changes because we know that the healthcare system as it stands financially is not something that can be sustained. So as we've talked about previously, there are many reports that have indicated that we really need to change how we deliver health care. That does not mean that we don't take care of those who are sick or have chronic illnesses, but we're shifting our focus more to a focus of value-based care delivery and looking at prevention and looking at different factors that will actually elevate the level of health versus fix something that's broken. So many factors come into play, and it includes, of course, the Affordable Care Act and what's going to happen with the repeal and replace. It involves the technology advances that we've experienced. So there are many factors that we're looking at. And within your book, there's a highlight on team steps, and that's very valuable information. And some of you may be practicing team steps within your organizations. And really, team steps encompasses what we're talking about is maximizing that interprofessional care delivery, that coordination of care, and building on communication skills and all those factors that come into play to deliver very coordinated care for the people that we serve. And if you aren't familiar with the Agency for Healthcare Research and Quality, that may be an organization to kind of take a look at, and that's the organization that developed Team Steps back in 2008. And there's also just a huge amount of resources available on their website as well. So if you want to take a look at that, I would strongly suggest doing so. And it may be helpful to you as you're producing some of your assignments also. So when we're looking at team steps, we're really looking at teamwork being interrelated knowledge and skills and abilities. So we're looking at the connectiveness of teamwork. And Team Steps itself is a very structured curriculum, and the focus is providing role clarity, delineating responsibilities, developing language for handoffs, dealing with conflict, reducing barriers to quality and safety. So it's the whole package as far as coordinating services to maximize quality and safety for those that we serve. And the implementation process is delineated in your textbook as well, but it has 3 phases, and that's the assessment of the need, planning, training, and implementation, then sustainment. So take a look at that in your book. And as I alluded to earlier, the complexity of care is something to also really hone in on as you're looking at this particular chapter, because too often, as we've talked about before, care is delivered in silos, and patients are living beings, and they are very complex, and we just can't fix one area or just focus on one area, whether it would be community care or acute care. They work together because people live in the communities, and they also seek care in the acute care facilities, so there has to be that transition of services for them, and sometimes we haven't been the best at making those connections for those that we serve. In addition, your book touches on population health as well, and again, that's consistent with some of the guidelines or the mandates within the Affordable Care Act, and really shifting to focusing on the managing care across the continuum. So we're looking at prevention and health promotion, and we're looking at primary care. Having that medical home is a critical factor as well, so someone's there to coordinate the care for those folks out in the community as well. So your book then goes on into the AON competencies, and I want you to really take a look at those competencies, and it's a wonderful opportunity to really examine the competencies, reflect on your own strengths, and the competencies can also provide you a way to look at opportunities for growth for yourself as well in your leadership practice. So you can really hone in on those areas to really refine as far as your leadership practice. So the AONE competencies are very valuable as you move forward. So in looking at the big picture, and looking at the transformation of healthcare, and as we've talked about, the Institutes of Medicine, the report, The Future of Nursing, there's a great opportunity for nursing leaders right now, and something that really hasn't occurred before, and we have the opportunity to really capitalize and be at the forefront in healthcare delivery. So congratulations to all of you as you're continuing your education, because that shows your dedication to building your practice and serving as a leader as we make these really incredible changes. So let me know if you have any questions or concerns. I'll talk to you soon. Bye-bye now.